In the last video, I mentioned that dopamine imbalance is associated with schizophrenia. For that reason, I decided to make schizophrenia the topic of this video. So here is Understanding Schizophrenia. Schizophrenia, which was previously known as dementia precox or premature dementia, is one of the most stigmatized mental illnesses. A person suffering from schizophrenia fails to comprehend reality and finds it difficult to make sense of what he sees, hears, or experiences. On April 24th, 1908, the term for this illness was coined by Professor Eugene Bleuler during a meeting in the German Psychiatric Association. In the meeting, Bleuler argued that, based on the data that he had collected, dementia precox had nothing to do with dementia or precociousness. So he provided an alternative word, schizophrenia, which he had derived from two different Greek words, schizein, which means splitting, and phren, which is a word that refers to mind. In 1911, Bleuler wrote, I call dementia precox schizophrenia because, as I hope to show, the splitting of different psychic functions is one of its most important features. In each case, there is a more or less clear splitting of psychological functions. As the disease becomes distinct, the personality loses its unity. The symptoms of schizophrenia can be divided into positive symptoms and negative symptoms. Positive symptoms refer to the symptoms that are present in the patient but absent from the general population. These symptoms include delusions, hallucinations, and disorganized speech. On the other hand, negative symptoms refer to absence of normal mental functions that are present in the general population. The symptoms for schizophrenia can also extend to false beliefs, unclear or confused thinking, paranoia, and withdrawal from social situations. Schizophrenia is further divided into four major categories: paranoid schizophrenia, catatonic schizophrenia, disorganized schizophrenia, and residual schizophrenia. In paranoid schizophrenia, a person believes that other people are trying to harm them or their loved ones. In catatonic schizophrenia, a person stops moving for a period of time or doesn't move at all. Disorganized schizophrenia is an uncommon form of schizophrenia that causes patients to have fragmented thoughts where they often exhibit disorganized speech or behavior. Lastly, in residual schizophrenia, there are no active symptoms, but affected individuals suffer from cognitive difficulties such as memory loss or difficulty in concentration. These symptoms start appearing between the age of 16 and 30, with men getting them earlier than the women. Antipsychotic drugs, which block the receptors for dopamine, are administered to schizophrenic patients to alleviate the symptoms. These drugs are effective in controlling the positive symptoms, but they can worsen the negative symptoms at the same time. The cause of schizophrenia is not completely understood, but it's thought to be caused by an imbalance in brain chemistry or genetic abnormalities. Wait, are you thinking what I'm thinking? I'm thinking that genetics would make a very interesting topic for the next video. Anyway, with this video, I had aimed to educate you all so we could collectively tear down the stigma associated with schizophrenia and promote a supportive community where people with mental illnesses are not looked down upon. If you know someone who is struggling with schizophrenia, be respectful, supportive, kind, and do encourage them to seek medical treatment and have them sign up for therapy.